Hi, so my question is actually about your opinion on healthcare, because I know that you believe that privatization of healthcare is the most effective means to solve the problems that we have. Yet besides thought experiments, I really haven't seen any evidence for that. For me, when you look at the facts, you look at more socialized programs such as Canada, they spend 10% of their GDP on healthcare, and yet their life expectancy is in the low to mid 80s. You look at the UK, and they spend 8.8% of their GDP on it, and the life expectancy is also in the 80s. But then you look at the United States, we have a more privatized system. We spend 15.4% of our GDP on it, and yet our life expectancy is lower. So my question is, why do you, my question is basically, if you look at all that, what it tells me is socialization of healthcare covers more people, makes life expectancy longer, and it's just more effective all around. So do you have any evidence or examples where privatization has actually increased healthcare?
Okay, so the truth is that we haven't actually seen a move from a socialized medicine system to a privatized system. So it'd be hard to find an example where moving from one of those examples to a privatized system works. And we haven't really seen even a system where we move from privatization to universal healthcare in the sense that the system has never been deregulated. I mean, my basic premise is that what we have now is almost the worst system. We have a mixed system, which has driven up costs because of subsidizations from Medicare and Medicaid, and has also driven up costs because of regulation, and then it's still privatized, so doctors are still charging a lot of money. The best example that I can use is a small-scale example because it doesn't exist in large scale. By the way, we can talk about problems in socialized medicine systems. We can talk about the fact that there is rationing of healthcare that does occur in places like Canada and Britain in a way it doesn't with regard to surgery, particularly in the United States. We can talk about cancer survival rates in the United States, which are better than cancer survival rates in socialized medicine countries. We can talk about the fact that it's not you really shouldn't statistically compare life expectancy between Canada and Britain and the United States because the populations are incredibly different. Just in terms of ethnic diversity, the ethnic diversity in the United States is very different from the ethnic diversity of Canada, right? Canada is nearly homogenous. The ethnic diversity in the United States is very different, and different ethnic groups do have different health problems. For example, heart disease is more prevalent in black men than it is in white men. That's just a fact. That has nothing to do with moral culpability or anything. That's a reality that is taught in medical school. It's the way they profile patients. So you'd have to find a comparable population to start. Then you'd have to actually model it out. But the best example that I can think of is, well, sorry, let me backtrack for 1 second before I get to the example. The theory is that the shortages in healthcare are largely driven by lack of supply, not rationing of supply. So there aren't enough doctors is the problem. If you had more doctors in open competition, it would drive price down. Now, the best example of this is in laser eye surgery. So laser eye surgery in the United States is almost entirely deregulated. It's not covered by insurance for most people. It's considered an elective surgery. And that means that doctors actually have to compete on the open market. One of the big problems in our healthcare system is if you walk into the doctor's office and you say, I want an x-ray, how much will it cost me? The doctor literally will not tell you. The doctor literally can't tell you because they have to run it through the insurance company. They have to bargain with the insurance company. They may be covered by this insurance company, but that insurance company. In a socialized medicine system, they just say zero. Well, that leads to an increased demand because there is an elasticity to healthcare demand, and that leads, in essence, to shortages in healthcare supply. Overall, that means that people may live longer because people can access healthcare whenever they want, supposedly. But it also means that when it comes to elective surgeries or when it comes to surgeries that can be delayed, those are delayed very often, and that's something you see from the National Health Service. When it comes to completely privatized systems, if there were complete transparency in price, then you would see an actual supply-demand curve. This is what you see in laser eye surgery, which used to cost $20,000 an eye, $10,000 an eye, now costs like $2,000 an eye because every single doctor went into ophthalmology or optometry, all of them. Right, there are 4 different fields in medicine. My wife's a doctor, as everyone knows, I've said 1,000 times. So that means that virtually everyone in her class went into what they call the ROAD system, right? Radiology, ophthalmology, anesthesiology, dermatology, mainly because those are the least regulated areas of the healthcare system, where you have to deal less with insurance. So I think that there's almost 2 separate questions with regard to healthcare. How well are the systems in Britain and Canada working? And by the way, if I were going to pick a socialized healthcare system that I think works best, I'd pick Switzerland, actually, where there's an actual mandate. But I think that because it actually is more privatized and there is some competition in the marketplace. But if you're just talking about what could you do to make the American healthcare system better, we're basically at the worst available points. If privatization is here and nationalization is here, we are here. Right? We're just at the low point of the curve. So I think if you move in either direction, it will get better, probably, in certain ways worse. I'm also very much afraid of a government that comes in and is going to have to mandate how doctors care for patients. because one of the problems that nationalized systems have had is people opting out of that, doctors opting out of caring for patients in this way. They've had to import doctors, for example, in places like Britain. There's a shortage of doctors in places like Israel, because who wants to go through 1,000 years of medical school to make 60 grand a year?